Bismillah ar-Rahman ar-Rahim. This is Shahana Ilahi, the director of Shaukat Khanum Memorial Cancer Hospital, talking to you. With the grace of Allah, we'll start our program. So to chair the session of nursing this morning, I'll invite Mr. Muhammad Yusuf, Assistant Director of Nursing, Shaukat Khanum Memorial Cancer Hospital, to come to the stage, and Dr. Nasreen Suleiman Lalani, Assistant Professor, Urdu University. So thank you very much, everyone, for participating in nursing session. To start our program, we will invite Mr. Muhammad Shahid Ras, nursing lecturer practitioner, for the recitation of Holy Quran. Mr. Shahid, please come to the stage.
Wajib. Bismillahirrahmanirrahim. Alam tara kayfa fa'ala rabbuka bi ashabil fil. ألم يجعل كيدهم في تضليل وأرسل عليهم طيرا أبابيل ترميهم بحجارة من سجيل فجعلهم كعصف مأكول. In the name of Allah, the most gracious, the most merciful. Have you not seen how your Lord dealt with the people of the elephant? Did he not foil their strategy and send against them flocks of birds, which pelted them with clay stones? Thus he made them like stubble cropped by cattle. Sadaqallahul Azim.
Mr. Shahid. So, Assalamu alaikum and very good morning to all of you again. Rahana Ilahi, the Director of Nursing, Shaukat Khanum Memorial Cancer Hospitals, is talking to you on behalf of the Organizing and Scientific Committee and Nursing Division. I welcome you all to the program of first session of nursing. The theme of the program is establishing a culture of quality, safety in oncology nursing setting. I welcome prestigious guest, Dr. Parveen Ali, Professor of Nursing, University of Sheffield, UK, and one of our very, very bright for nursing in Pakistan. I also welcome a good friend of mine, Dr. Nasreen Suleiman Lalani, and I'm proud to say that one of my classmates in post-R and BSc and nursing program, Dr. Nasreen Lalani, is working as assistant professor at Urdu University, Indiana, USA. And very near to my heart, friend and part of Friends of Shaukat Khanum, is Ms. Lubna Ghazaldeen for Farooq Mukhtar College of Nursing, Mukhtar Sheikh Hospital, Multan. And the prestigious guest from Shaukat Khanum and other hospitals, I welcome you to the program. We have a session from 9 to 11. In this session, we have plenary talks and a free paper, and we have poster outside displayed for all of you when you finish this session, and you are in your own time, you can go and review it. So please enjoy the program. Tomorrow, we will have a second session, inshallah lazim. We have plenary papers, as well as we have nursing researches presented tomorrow. And as you all know that those researches which are selected for the program are the beautiful best researches, and one of them will be selected for the award. So thank you very much and enjoy your day.
Assalamu alaikum, everyone. I would like to invite Dr. Parveen Ali for her session on innovative approaches to sustain safe nursing practice in oncology setting. Dr. Parveen Ali.
Assalamu alaikum, everyone. Thank you so much for having me here. And I'm really glad to see so many familiar faces and so many new faces as well. So I'm just going to talk to you about innovative approaches to sustain safe nursing practice in oncology setting. And I will keep on flicking my glasses on and off. The reason being कि वो ऐसी जगह पे पहुंच गए कि जहाँ पे आप glasses पहन लें तो आपको सामने की चीज नहीं दिखती, और glasses ना पहने तो आपको दूर की चीजें नहीं दिखती. So please bear with me. So a little bit about myself. So I work at the University of Sheffield and Doncaster and Bassett Law Teaching Hospitals as Professor of Nursing and Professor of Gender-Based Violence. Why these two different titles? The reason being that I'm a nurse by background, and my role at Doncaster and Bassett Law Teaching Hospitals is about increasing research capacity among nurses, midwives, and allied health professionals. And gender-based violence and domestic abuse is my area of research. So therefore, those two titles are there. I'm also editor-in-chief of International Nursing Review. So those who are into professional and scientific publications would probably know that journal. This is ICN's International Council of Nurses official journal, and I edit that journal. Telling you these few things that if you ever need any support or if you have any questions about any of these aspects, I am more than happy to help you. So today I'm going to talk about innovation and what innovative practices we have in nursing generally and with regards to oncology nursing. As we know that prevalence of cancer is on increase, and if we look at the developing countries, it's expected to double over the next 2 decades. Which means that it's going to go from 12 million cases per year to 20 million cases per year by 2040, which is about 75% of global cancer cases. So the prevalence is going to go quite high. And at the same time, because of the advanced technologies and the good care that we receive from nurses, people are living longer. Which then means that we have to adopt to our approaches as to how we manage those patients, how we make sure that people who are living, they live as much healthy life as possible. So we need to be able to think about providing best care, providing best support, and how do we actually do that? Innovation. What is innovation? We've heard about that term quite a lot of time, but I think we do not necessarily always kind of pay attention to it. So if we define innovation in English, it's the intentional introduction and application within a role, group, or organization of ideas, basically doing something differently. Okay, developing and delivering new or improved health policies, system, products, technologies, and delivery methods that improve people's lives. Are we innovators? How many of you would class yourself as innovators? Anyone who would raise their hand? There is one hand which I can see at the back. 2. Yeah, 3. Okay. And I'll come back to you in a minute. उर्दू में क्या बोलते हैं इनोवेशन को? जोर से बोलो थोड़ा सा कोई. नहीं, उर्दू में ना यार. इजाद. बिल्कुल. और एक और नई टर्म भी है उसके लिए. ठीक है? तो innovation is all that I've just talked about. कि जी doing something different, doing something new. But एक जो word इस्तेमाल होता है ना, that is called जुगाड़. ठीक है? और जुगाड़ अपने आप में बता देता है ना कि it's doing something different. It doesn't have to be something completely new. It's a new way of doing it. Unfortunately, when we talk about जुगाड़, हम उसको कुछ गलत ही समझ लेते हैं बहुत बुरी तरह से. But actually, जो आपका सॉरी मैं इसके पीछे बिल्कुल छुप जाती हूँ तो थोड़ा सा साइड पे बैठ करूँ. तो जो आपका जुगाड़ है वो किसी भी चीज को नए तरीके से करना है, and that's the start of it, because then what you could do is you could adopt to it and you can then उसकी शक्ल आप अच्छी कर सकते हैं, उसकी presentation अच्छी कर सकते हैं, but that's how it starts off. Okay, so the underlying question that we always have to address, and why do we need we do that, is how can we improve patient outcomes, or how can we improve whatever we are doing in practice, उसको अच्छे से अच्छा कैसे कर सकते हैं? That's the underlying question that we are asking. When it comes to innovation in nursing, some of you said that you are innovators. Can you give me an example?
Assalamu alaikum and good morning. Assalamu alaikum. I'm Musarrat Parveen, working as a nursing lecturer practitioner and breast care nurse as well. There is one jugaad with us also, which is very beneficial and supporting to our breast cancer patients. That time, that is not innovated by myself, but it was already innovated by my seniors. Because the silicone prosthesis for my patient who were having mastectomies, it was very expensive and they are unable to afford this cosmetic.
Okay.
So that time, my colleagues, my senior nurses, they tried to maintain it by wheat bags,
Okay.
replacing the lost part of the breast. But that was not useful. Then they thought, and we got one donor. And they gave us one idea that there were plastic beads. And nowadays, that donor, she is donating us a bag of beads, which we are providing to our patients who are unable to purchase that silicone prosthesis.
Excellent.
So that is very beneficial, and we are getting more patients in our support group who are coming to get that prosthesis of beads.
Okay, thank you. And that must have improved quality of life for so many people, right? So in terms of improving their confidence, improving their self-image and everything else. So yeah, so and in terms of innovation in nursing, though nurses do not consider themselves innovators, किसी को भी पूछे ना वो कहेगा जी नहीं हमें तो कोई innovation हम नहीं करते. And nursing have a history of eating our young. तो जैसे हम कहते हैं ना कोई नई चीज करने जाते हैं तो हम कहते हैं नहीं जी this is not, ऐसे नहीं करते, हमने हमेशा ऐसे किया है और ऐसे ही होगा. This generation, you still probably do not see that much. जहाँ पे हम जिस time कर रहे थे education and training at the time, it was even worse. That you couldn't really think of anything different. People were not accepting it, and it's not changed much, but it still is a problem. Having said that, we have always been innovators, starting from the World War I, or शायद उससे पहले भी. ठीक है? World War I we talk about from the time of Florence Nightingale, because that's the time that people have started documenting and people have started talking about it. But it's not that we were not doing it. So it was at that time when nurses started recognizing the issues with infections or head injury or दूसरे traumas के साथ जो patients आ रहे थे, what can we do about it? So they invented antiseptic cleansing techniques for infections. They started, Florence Nightingale is very famous for the first person who started presenting data in charts. Nowadays, we use pie charts everywhere, but she was the one who started off doing this. This was the time when people started thinking about empathy, that how is it an important aspect of nursing care that needs to be included in everything that we do. And that was the time when people started looking at the plastic surgery, physical therapy, occupational therapy, and all of those other aspects to be included into healthcare, because people were affected by war and its related impact. So we've been doing all of this from very long time ahead. So this is the example of the chart which Florence Nightingale presented. And what she actually did was that she knew that people were not dying just because of the infection they were getting it, but it was because of the not good conditions in which they were living in, lack of ventilation, other aspects, and nobody would listen to her. So what she did, she started documenting all of those places and then presented that data in a way that people could understand that there are cases which are, people are dying because of different aspects. So here, if you look at this chart, it's known as Nightingale Rose or Nightingale Coxcomb, it's also called. Okay, it displays the causes of death of soldiers during the Crimean War, divided into three categories. One is preventable or mitigatable zygomatic diseases, which is infectious diseases, including cholera and dysentery, and that all is shown in blue. Okay, then you have red area, which is wounds, people who died because of the wounds, and then there were other causes which are shown as black. So by just looking at the picture, you can see that how many people actually died because of cholera, dysentery, and other aspects, and how many people died because of wound or other aspects. And that's when people started understanding and recognizing that infection is a big issue and we need to do it. And this was the graph that took her as a member of Statistician Society in London. And she was the first woman and first nurse to be on there. So what have nurses invented? Well, you might not realize, but we have invented quite a lot of stuff. So for example, ostomy bags. Do you know that that's an invention by nurses? How many of you knew that? Yeah, not many people know about that. New slips. And that's something which helps put the slips on, makes it easier. Crash cart is an innovation of nurses. Neonatal phototherapy machines, that is invented by a nurse. Color-coded IV lines, that's invented by nurse. Feeding tubes for paralyzed people. Sanitary pads that are developed by nurses. Intubuses, which is for neonates and बहुत जो छोटे बच्चे हैं उनको tube feeding के लिए किस तरीके से get it, that's a type of a dress. And when you get a chance, try and have a look at these different things, because what it will allow you to see that innovation doesn't have to be दुनिया बदलने की जरूरत नहीं है. ठीक है, कोई सीढ़ी नहीं चाहिए जिस पे चढ़ के आसमान पे चढ़ना है, तारा तोड़ के लाना है तो फिर इनोवेशन हो जाएगी. नहीं, it is about doing something that we are already doing more effectively and clearly. Okay, so when it comes to oncology nursing, it's, as you all know, it's the aspect of medicine that deals with the study, diagnosis, treatment, and prevention of different cancers. And it's a specialized form of nursing that focuses on providing care for cancer patients. Now, when we talk about innovation in nursing, we always talk about randomized controlled trials or medications that can be used to extend lives, or that can be used to sort of somehow make people better or relieve them from their pain. But there are many other things that we do in between. That is about improving patient satisfaction, improving their care pathways, making sure कि जो उनका waiting time है emergency में किसी जगह पे वो कम से कम हो, and so many other examples. And this is why the focus on from randomized controlled trials and that kind of scientific research is moving a lot faster to social innovation, which means that you have to include your patients, providers, healthcare professionals into developing those interventions which work. Because even if you think about it, even a medication when it is developed or when it is used, who is the person who would know the impact of that medication if it's working or not? It would be either the patients who are taking it or people who are administering it, those medications. And if you do not involve them, you're never going to be able to see what's coming. And again, in the past, it's not that nurses have not been involved in developing those interventions or innovations. It's just that we have not been acknowledged or recognized. And as nurses, we have never demanded that. So the challenges that we are facing today with regards to oncology nursing is that pandemic like COVID-19 has taught us a lot because hospital was closed, raaste band ho gaye, sab khatam ho gaya kisi tarah se. So how do we make sure that we still interact with patients? We still sort of make sure that they get everything they need. And that's where healthcare organizations where telemedicine, face calling, remote consultations was never happening. All of a sudden, hospitals started kind of incorporating that or increasing the use of those aspects into it. Global shortage of nurses, we are a very kind of precious commodity जो कि available नहीं है पूरी दुनिया में किसी भी जगह पे. Global shortage of healthcare professionals, which then pushes us to think about different new roles where we need to do things differently. Increasing prevalence of cancer as well as the need to provide care differently. Patients are just not limited to hospitals. They're just not only within hospitals. They live longer. They are at home. So therefore, the role of nurses could be in various different aspects. For example, providing home care, things that can be done home at safely, doing all of those sorts of things, contributing to screening of different types of cancer, increasing awareness, knowledge, palliative care, and those are some examples. Use of technology is on the rise, so we can't just sit back and relax and kind of, not pay attention to it. And cost of living is increasing, and therefore we need to look for the options which are cost effective and help people live longer in a better fashion. And as I just said, care is not limited to hospitals only. So what opportunities do we have? Well, there are innovation or doing something differently. I could talk about various, take one example or uspe pura ghanta baat aap kar sakte hain ki do this and do that. But I am a believer in talking about principles. So if you learn about principles, you can apply those principles regardless of the situation that you're working with and improve this. So the stuff that we are doing at the moment in the whole world as nurses is about patient-centered care. So everybody is talking about that whatever we do, it has to be according to the needs of the patients, which could be very different. And that's your example comes in that when you look at the needs, what they want, when you look at the cost of the issues are there, then you try and find a way where you match all of those things. And then you do research and try and explore if that particular innovation or jugaad is working or not working, and how can we make it better in terms of uski shape अच्छी कैसे करें, उसकी शक्ल अच्छी कैसे करें, उसको उसकी खूबसूरती को कैसे बढ़ाएं, acceptability वगैरह को किस तरह से increase किया जाए, right? Nurse entrepreneurs creating solutions. We have got nurse entrepreneurs who are creating solutions and are working around the world. In the world, people who create innovations or create companies and aspects like that, we value them and we call them entrepreneurs. पाकिस्तान में हमारे यहाँ थोड़ा सा मुश्किल है, थोड़ा सा different है, because हम समझते हैं कि if someone is deviating from nursing, उसको हमने आग कर देना है profession से, वो अब nurse नहीं है. That is actually not really a useful thinking. The reason being कि इस वक्त आप पूरी दुनिया में अगर देखें, and if we take the example of medical colleagues, they are very successful. So you would find universities की example ले लें तो deans और vice chancellors बहुत सारे आपको ऐसे मिलेंगे जो कि doctors होंगे, politicians, people who have been prime ministers, people हमारे अपने मुल्क के सदर जो हैं वो dentist हैं. So that is an example that people go into other different fields which are available to them, and they're still owned by their professions. And that gives us those chances where we could not only benefit ourselves as individuals, whoever is doing it, but at the same time, bring up the nursing profession and do for the benefit of that, because people need to learn what nurses can do, but embrace that nursing identity. The other aspect is post-cancer remission support is increasing. As I said, people are living longer, and sometimes the cancer remission happens as well, or you need to explore if it's happening or not. And that's where another opportunity where we can involve nurses. User-centered experiences. So a lot of the products and other aspects which are developed by companies, that's where we can add ourselves, and that's where we can present ourselves and look, we know what's happening, what's the needs of the patients, because I'm a nurse and I've worked with patients that many years and I know that. And that's how we are some of the opportunities which are used around the world by people. Automating and streamlining processes, be its admission process, be its data capture, be its use of that admission, be its identifying people from screening to taking them to diagnosis and treatment, and afterwards looking into it, or identification of sepsis. Koi bhi aap example le le. We could think about how to automate the system and how to streamline it. There are different roles that we need to think through throughout the world. There are, of course, specific areas where nurses work in, and broadly speaking, they are clinical, management, teaching, and research. So if you look at it within clinical, throughout the world, people are working, starting on from staff nurses to advanced care practitioners, clinical nurse consultants, where they not only sort of administer or prescribe medications, but they themselves prescribe therapies, and they're doing surgical procedures and other aspects to it. Management level, starting out from unit to organizational, national and international level. Teaching wise, again, all of those things, and koi bhi jo ye charo jo aspects, and they relate to each nurse. So wherever you can start off from very early on to then develop into the field at the top, and you don't necessarily need to be limited to nursing. Why can't we have just say directors? We've got directors of nursing, we've got directors, medical directors, but there are organizations where chief executive officers of the organization, of the bigger hospitals, are actually nurses, because they know what's happening in those places. So those are the opportunities that we have. How can we do it? Understanding innovation. What is innovation? So broadening our ideas about, what is it that we need to do? Questioning ourselves, trying to find what is the problem and how can we solve that problem easily. Nothing is small. One of the examples which I always give to when people come to do PhD, what they want to do is they want to change the world. And at that time, it's just so difficult to bring them down. Unko bolo ho leo ja thoda ja, aista, ye wala kaam karte, because the student, whoever, and I've seen this time in and time out, sometimes they get upset, sometimes they get really sort of, no, I wanted to change the world, and my supervisor is not supporting. And by the time they get to second or third semester, so the data is that huge, at that time they realize, no, actually what this person was saying was fine. So one of the example which I use is, कभी वो needle देखिए जिसमें धागा निकाल के जिससे तुरपाई करते हैं या suturing करते हैं, वो उसका जो वो धागा डालने का जो सुराख है वो कितना छोटा सा होता है. Somebody has actually done PhDs on that little place and have written more than 200,000 words on it to get a PhD. So nothing in the world is ever small. So it's thinking, how do we do this? Ensuring nursing is a degree profession. What it does is that it helps you understand and brings you at the level of all other professions. And as nurses, we all have to strive for it. So you just need a caring personality to be a nurse. I'm really sorry. Yes, you do need a caring personality to be a nurse, but you need dimag and you need intelligence and you need critical thinking. That you develop through degree professions, and it helps you with a head start with other professions that are all at the same level. Getting higher education, not only in nursing, but in other fields. Because at the end of the day, if you start looking at any of the master's program, in any field, they would teach you pretty much similar things. Research process is not going to change for a nurse or for a doctor or for somebody else. It's the same. Ethics is not going to change for a nurse or for a doctor or for somebody else. Consent लेने का तरीका हमेशा एक ही रहेगा. उसकी मीनिंग हमेशा वही रहेगी जो है. So it is about expanding those opportunities, but then bringing it back to nursing and taking the examples from nursing to those fields. Increasing interaction with other disciplines. That's where we identify how do we make changes. So COVID-19 was a really good example where when it started off, people didn't know anything about masks, visor, sanitizer. There was a shortage of sanitizers all across the world and people started. So what we did was brought multidisciplines together. So you had engineers into it, doctors into it, nurses into it, all different professions together, who then talked about how to make sanitizers, for example, within homes, hospitals, and that's how it all started. How to use, develop visors and PPE ki jo equipments, and wo kis tarah se bani. And that's just a simple example. There are many other examples like that. So when we interact with other departments, when we use artificial intelligence, when we use digital technologies, at that time we know how do we solve the issues which are complicated, but we can adopt technologies to make it work, and we can use the knowledge to make it relevant to ourselves, to the profession, and to the patients that we serve. Supporting our younger generations for asking questions. No question is ever stupid or wrong. Asking questions helps you understand and takes you to the next step. फिर आप उसको modify कर सकते हैं, develop कर सकते हैं, check कर सकते हैं, you develop a product and then you try and explore how that works. Acknowledging and recognizing innovation. So small little thing, be it's किसी उस पे आपके ward में counter के ऊपर से चीजों की तरतीब बदल देना ताकि कोई पर्चा निकालना आसानी से किया जा सके. That in itself is an innovation, whether you like it or not. Okay. And when we work in research studies and other aspects, making sure that we are acknowledged for it and we are recognized for it. So with regards to research, nurses do a lot. We think many of you, if I ask you, do you do research? And you would say, no, I don't. But actually you do, because a lot of research that happens, who collects the data for those research? Who collects blood samples? Who provides information to patients about whatever is happening? Karte hain na aap sab log? And that's where we contribute to it. So trying to recognize the role that we have. Research nurses who contribute to all of those aspects, most of the time they're not acknowledged into papers or identified as authors. So trying and acknowledging those aspects and asking for it would help us and would get us respected. Developing funding resources and encouraging engaging in research. That's where like those practices that koi aapne chart banaya hai or something like that, and then getting it patented. A lot of the innovations that nurses did earlier on, they're not probably patented on their name. So a lot of the machines, a lot of digital technologies, a lot of stuff that's happening, that's being used in medical devices, for example, ostomy bags, or there are many other examples. We do not necessarily talk about nurses. We don't know that nurses have done it because we do not shout about it. So it's just recognizing those aspects and taking them to next level and getting it licensed to and getting those people acknowledged on those places. So that's it is all about. So some ideas are simple, but they make huge impact on people's lives. And that's where we need to embrace those ideas. Innovation doesn't mean creating something completely new or completely different. It is just a different way of doing things because the technology that we have, we use that. हम अभी तक घोड़ों पे तो सफर नहीं करते ना. कारें कैसे आई? Because you have got new things available and that's how we started using them. So let's create a culture of innovation where nurses feel confident in sharing their ideas and receive resources to help further their concepts into actual solutions, which makes their patients and everybody else's lives better. Thank you so much for listening, and I'm happy to take any questions. Do you want me to stand here?
And thank you, ma'am, for such a nice presentation. And you talked about the innovation in nursing, and I think the role of nursing school is really key for its development. I remember my nursing clinical when I was doing my degree program at Khan University, and where we used to make clinical integrated mapping for the patient. So one day what happened is me and my colleague, we were developing the CIM for our patient. So one of the more renowned physician at Al Khan University, he was a pediatric cardiologist. He just came over and asked, what you people are doing? So my other colleague, she explained the clinical integrated mapping in detail, that this is the diagnosis of the patient and these are the signs and symptoms, and these are the radiological findings. And this is how you create things and how you link things. So he said that it's wonderful thing. So he just called his one resident and he said, this is the wonderful thing. Can we just do this thing for the medical student? And can we do this in our daily clinical round with the patient? This is how the nursing and the nursing school and they really help you in developing these critical ideas. So Ms. Lubna can better add on this, that how the clinical integrated mapping that we use in our clinical and that how create critical thinking for nurses. And of course, the nursing school, they really play a key role in this process. Thank you.
Thank you. And what probably would be different here is that we create those solutions, but then we don't necessarily own it. We don't write papers. We don't kind of tell the world about it. We don't go for poster presentations. It's getting better, but it wasn't there before. And that's where your ideas get somebody else uses it. They think it's useful. And then next thing you know, they've written papers and they've explored it further. So that's where you need to capture the thing, stick with it, और छोड़नी नहीं है वही चीज ना, फिर उसको लेके आप जैसे जैसे आगे चलते रहते हैं. Persistence makes it easier and helps things develop further. Thank you for sharing that example. Anybody else? Any questions? No? Thank you. Thanks for listening.
For an innovation word. और मुझे आज भी याद है कि हम तो AKU में पढ़े हुए थे, तो हम we always use innovative things. We already had those. पर जब हम जिना में जाते थे और सिविल में जाते थे तो चीजें नहीं होती थी, तो हम टीचर के पास भागते थे कि किडनी ट्रे तो नहीं है, पेशेंट वॉमिट कर रहा है. तो मुझे याद है कि टीचर ने हमें बताया कि take the drip and just cut it in a shape to make it a kidney tray. And I still remember that we never had those aprons and we used the dustbin bags, the black bags, and made the aprons. So those were the little innovations that we always did. तो मुझे ये भी याद है कि ज़रूरत इजाद की माँ है. So as nurses, we should use our critical thinking. just बहुत अच्छे से परवीन ने explain किया, and we do it in our daily lives while caring for our patients. And that's called the compassion for the patient, that you really want to do something for your patient, and then you come to the innovation and you bring the things whatever they want. So excellent.
Thank you. अब आपको वर्ड याद रहेगा ना, जुगाड़ जहां सुनोगे तो इनोवेशन याद रहेगी. ठीक है? Thank you.
Yeah, thank you so much, Dr. Praveen. There's a lot of going for innovation in nursing, and definitely we start from small steps. Our next speaker is Dr. Nasreen Suleiman Lalani, Assistant Professor, Purdue University, Indiana, USA. Dr. Nasreen will talk about defining empathy, care, and compassion in the digital world. As you know that everything in medical industry is moving to the digital world. So I hope that you will all enjoy the session. Thank you.
So thank you very much. Thank you for the wonderful audience, and Rehana for inviting me. Rehana and we both were classmates. We used to study together in one room and it was a wonderful time. But I'm glad that we all have moved on and we are doing good for the nursing profession. I'm Nasreen Lalani, and I'm currently working as an assistant professor at Purdue University in US at the main campus in West Lafayette. I have more than 20 years of experience in nursing. So when I talk, I don't talk from just the books, but you can ask me anything, whether it's related from a management position, from a research position, or a faculty. I think it's all about experiential, and I have learned a lot from the experiences, and that's what I would like to bring to the table for you people and for each one of you. But my passion was always studying about the psychological aspects, the psychosocial aspects of the patients, and that's where my research is around end-of-life care and the palliative care. I have worked in a hospice setting where I developed that passion. And now all my research is about end-of-life care, palliative care, spiritual well-being, and spirituality. But my today's topic would be about the empathy and compassion in a digital world. So we heard a lot about a lot about the innovation, but the biggest innovation that we are facing in today's world is the technology. So technology is happening so rapidly. We are having so much applications. We are having virtual visits. We are having, everything is turning into virtual. We are talking about artificial intelligence. But then the question remains that how can we bring those psychosocial aspects, that compassion, while living in the digital world? So that's what I'll discuss in my session today. So this is some slides of the Purdue University. So the slide here, down here on the left side is my nursing school. So we have a nursing school where we have all undergraduate programs. We have DNP programs, that is Doctor of Nursing Practice. And recently we have started a PhD program that I will announce at the end of my session. And you people are always invited to apply for the program. And then we are called as boiler makers because the bigger boilers, the engineers that use has been invented at the Purdue University. So they are called boiler makers, and we have a lot of games and activities at Purdue University. And it's been like more than 150 years to Purdue. Like when I joined in 2019, it was 150th year of Purdue. So it's a quite old university, and it's a public land grant university, and we have a lot of programs. We have 5 nurse managed clinics, and nurses are actually working in the rural setting. And I think Pakistan needs that because sometimes the doctors or the other professionals don't prefer to go in rural settings, and that's what is happening in US also. We think that in US, everything is like fancy, but it's not like that. Even in rural areas, I have seen they have the same kind of struggle that we have. But because they have nurse practitioners and they are currently working, so Purdue has 5 nurse managed clinics, and they all are working in rural settings. And it's been a very successful program there. So this is again one of the biggest achievements. So the objectives of my today's presentation is like define compassion and empathy. So what is compassion and empathy? And then discuss about the cyber caring theory by Gene Watson. So we might have heard that the caring theory was given by Gene Watson, but now because we are entering into the digital world, how that caring theory will be changed or is changing, and how can we bring the compassion and empathy in living in the world of digitalization. That is what Jean Watson is talking about, but she has talked about more from a teaching side. But I will kind of have integrated from an application side. Then we'll discuss the principles to apply compassion and empathy in the digital space and describe ways providers achieve self-care to enable self-care and genuine connections for their patients and families. So how we can apply those things. So I kind of looked at some of the statistical data of the mobile users in Pakistan. And I found out that there are 173.2 million mobile users in Pakistan, which means that 77.7%, like nearly 78% of the total population is using mobile. There are 61.34 million internet users in Pakistan, which is 1/4 of the population, and it has increased by 11 million. So we can just imagine that how many people are using mobile and how many people are using the social media, and how we can build on those things that we can provide the healthcare using the digital medium. So like majority of people in Pakistan are using mobile applications, they are using internet, and they have the internet. But the question is here that how can we provide compassion? How can we be empathetic when we are providing care to them on a virtual medium or through mobile applications? So this is one of my study and one of my publication, and you can Google it. And when I ask patients, and this was a study not about the digital medium, but when I asked patient, what is your need? And this was done in a hospice setting among the patients and families who were near to death, like they were the terminal stages of their cancer. And most of the patients said, I need presence and listening ear. So sometimes we become so mechanistic in our own responsibilities, in our duty, इतने ज़्यादा mechanical हो जाते हैं, इतने ज़्यादा robotic हो जाते हैं कि हम सिर्फ ये चाहते हैं बस इसको दवाई टाइम पे मिल जाए, IV टाइम पे मिल जाए, medication टाइम पे मिल जाए. लेकिन हमारे पास इतना टाइम नहीं होता कि हम उसके पास बैठें और उसकी बात सुने, वो क्या कहना चाह रहा है. लेकिन जब पेशेंट्स को अगर हम पूछें तो वो ये कहेंगे कि हमें जो है वो आपका प्रेजेंस चाहिए, आपका लिसनिंग ईयर चाहिए. One of the patient told me that if the provider doesn't listen to me, it feels like everything is falling. सब कुछ खत्म. तो आप सोचें कि वो कितने उससे बोल रहा होगा कि अगर प्रोवाइडर मुझसे बात नहीं करता है, अगर वो मेरी बात नहीं सुनता है, तो मुझे ऐसा लगता है कि सब कुछ खत्म हो गया, मेरी पूरी दुनिया खत्म. So this is so important sometimes for the patients and their families both. I still remember when I was doing my interviews for my PhD research, and there was a lady came to me and she was so much like frustrated, I don't know. And she just came to me and she sat with me and she said, I will give you interview. I will give you your research interview, because she was thinking, because I am there, I'm a researcher and I'm there only for the interview. So I said, okay, fine. I'll take your interview whenever. But then she told me, please listen to me. I said, okay, fine. I sat with her and she said all about, because her father was dying. He was on the deathbed and she wanted to ventilate everything that she was going through, her family was going through. And as soon as she was about to finish ventilating all those feelings, we heard a loud noise. And that loud noise, that patient actually died because we heard screaming and crying. And it was her father who just died at that moment. But then she just rushed to there. But she had a different facial expression, because to me, it was like that whatever she wanted to say, and I don't know till how long she has kept those feelings inside her, but at least she could ventilate those feelings. And now she knew that her father would die, but at least there was some support she received after ventilating, and that support was a support to her own grief. So it was a kind of grieving therapy to her, and she was much, much relaxed after saying all those things that she wanted to say. So sometimes we don't realize those things, but it is very important for the patients, because death is it's not only for that patient, but it's a collective journey. It's for the whole family. And the people who do not grieve or who do not get time to grieve, they have a very difficult time in their grieving process that runs in years. But if they get chance to ventilate and express their feelings, it becomes much easier for them in their grieving process. And I am saying these things to you people because you all people are working with cancer patients. And even if it's a cancer survivor or a patient at a terminal stage, all cancer patients have a fear, and especially in our society. The word cancer is so fearful and so scary that it's not about the medications or the chemotherapy. It's also about those fears, those feelings that needs to come out, and that needs time. So another research that I did during COVID, and it was mostly about asking that because during the COVID, we know that there was no visitor policy. The nurses were kind of communicating with the patients and families using the iPad or some monitors or on phone or other things. So a lot of technology use has happening during the COVID time. So when I asked, and this is my another publication, and you can again Google it. And when I asked providers that how do they feel when they were using the technology, and it was very hard for them, especially with the patients and families who were dying. So it was very hard to them using the technology and then like, because there's a space, right? So when you are in person, it's different. When you are on a screen, it's different. So most of the providers said that it was very hard for them to do the communication and to help the patient. And there they realized that how we can build those competencies so that we can be competent and we can be empathetic using those technologies and being in the digital world. So again, here I am just put the definition of compassion and dignity. So compassion, dignity is about respect. Empathy is about feeling. So you are feeling and you are putting yourself in someone else's shoes. That is empathy. It's just the feeling. But compassion is the intent of doing something. So for example, you are seeing the patient and family in suffering, but then if you have an intent to help that person, that is where the compassion comes. So it's not just the empathy that we need to develop, but it's also about the action. That are we ready to take that action? And then we will call it as compassion. And when we are in nursing, especially, we are dealing with humans. So the humanistic caring approaches cannot come without compassion. But then a question comes, and it's also like throughout the literature, that whether the compassion is just an inherent quality that every person has, and only a nurse who has this inherent quality can be a good nurse, or it can be learned through experience. And there are different researches on that also. And I think my experience says that yes, we can learn it through our experience, because as we grow older, as we go into different settings and we meet and families, we develop that quality in ourselves. So maybe when I was a first year nursing student, maybe I was not that compassionate. But when the first time I went into a hospice setting, and as I grew in my profession and I was in my final year, so that quality I slowly developed. So it's kind of a debate that it could be an inherent quality that a person has, and probably that quality has brought you into the nursing profession, or you can develop that quality over time and with your experience. So what are the principles of compassion? How can we develop compassion in ourselves? So it's an act. So the first thing is about being kind and non-judgmental towards the self rather than self-critical. So it's very important that it's not being kind towards others only. If you are not kind to yourself, if you are not taking care of yourself, you cannot be kind to other people. So it is very important that you are kind to yourself. You need to forgive yourself. Sometimes we are in so much guilt, we do not forgive ourselves, and then we cannot generate that compassion for the others if we are not compassionate for ourselves. So we need to be kind to ourselves. हर वक्त जल पे घुटते नहीं रहना, हर वक्त अपने आप को सजा नहीं देना. अगर आप ऑप्रेस होंगे, आप खुद अगर ऑप्रेस होंगे, आप सामने वाले को एम्पावर नहीं कर सकते. This is impossible. The second thing is mindfulness, that you have to build peace in yourself. और वो peace कहाँ से आएगा? It could come through prayers, it could come through yoga, it could come through deep breathing, or giving yourself time to just cultivate your thoughts and find peace in yourself. So that's the second thing. And the third thing is about deep sense of humanity. So like, it's about seeing other person suffering as part of human condition rather than कि भाई ठीक है ये suffer कर रहा है, इसको cancer हुआ है, मतलब he is just one person. No, you have to understand the suffering of the other. So now, like entering from the world of caring into cyber caring. So I just put this quote: the internet is an item of consumption full of nutrients that are both healing and toxic. So there is a lot of information on the internet. It's kind of every kind of information is there. But then we have to think that what information we want to use, what information is for healing and what is toxic. Like मेरा बच्चा है, वो हर चीज के लिए जो है वो मुझसे नहीं पूछता, पहले वो इंटरनेट पे देखता है. फिर जब वो मुझे पूछता है तो मैं उसको कहती हूँ, फिर वो मुझसे आर्ग्यू करता है, मैं उसे कहती हूँ अपनी गूगल मम्मा से पूछ लो, क्योंकि मेरे को उसी को सुनना है. लेकिन वी हैव टू सी कि वहां पे कौन सी इंफॉर्मेशन है, क्योंकि वहां पे इतनी सारी इंफॉर्मेशन है. और अभी जो है हमारे लिए ये भी चैलेंज होता है कि हम कुछ भी पेशेंट को बताते हैं, फैमिली को बताते हैं, तो वो हमें बोलते हैं नहीं ये तो गूगल पे ये लिखा हुआ है. तो देन वी हैव टू थोड़ा सा अपने आप को पेशेंट रखना पड़ता है, एंड देन यू हैव टू टेल देम कि ओके मे बी दिस इज द इंफॉर्मेशन बट दिस इंफॉर्मेशन इज नॉट एविडेंस बेस्ड, or probably it's not like what you are looking for, and this is not the right information. So before telling to the patient, we should know ourselves. हमको पता होना जरूरी है, और हम उसको फिर किस तरह से बताते हैं. It's so easy to ingest a lot in just a few minutes online. This doesn't mean that you shouldn't use the internet, but you should be conscious of what you are reading and watching. When you write an email or a letter, this is full of understanding and compassion. You are nourishing yourself during the time that you write that letter. Even if it's just a short note, everything you're writing down can nourish you and the person to whom you are writing. So here, this is by Dr. Watson, and here she's saying, just an email here. Even that email, like, even in the digital world, how can we create the transformation? How can, because the love and caring or the compassion that we give to the patient doesn't have any boundary. She says it doesn't have any space boundary. It is not necessary that you have to be in person to give compassionate caring to other people. It can be given through digital, but then using a digital medium, we have to see कि हम वहाँ पर कौन से words use कर रहे हैं, कौन सी language use कर रहे हैं. जब हम students को email लिखते हैं, तो हम किस तरह से लिखते हैं, हमने कौन सा font use किया है. और this definitely has an impact. अगर हम सब कुछ capital letter में लिखते हैं, it means it's a very rude email. So वो चीजें भी जो है बहुत important होती है, जैसे हम ये शो करते हैं कि हम उस person के बारे में कितना attentive है और हम उसको कितना presence show कर रहे हैं. Because everything we write, every letter we write, every word we write and how we write, it has an impact. अगर student हमसे कोई complain भी कर रहा है, तो how would you tell that student कि yes, thanks for sharing your concern, and then you can write okay blah blah. But then that one sentence starting from the thanks for sharing your concern probably make the other person feel that, okay, she is actually reading and accepting whatever I'm saying, at least she's paying the attention, maybe not accepting, but paying the attention, and then you can inform. So हमारी language, जैसे हम Twitter पे है आजकल क्या हो रहा है? हर किस्म की गालियां चल रही हैं, हर किस्म की हम language use कर रहे होते हैं, हर किस्म के title हम दूसरे person पे लगा रहे होते हैं. Are we showing compassion? किस तरह की society हम आगे लेके चल रहे हैं? किस तरह की role modeling हम कर रहे हैं? Everything matters. इस पे बात कर चुके हैं. Okay. Then what is caring? Caring is the primary reason for human existence. Caring को हम कैसे define करेंगे? When the one caring connects with and embraces the spirit of the other through authentic, full attention in the here and now, and conveys a concern for inner life and personal meaning. So it's all about connectedness. हम सब जब आपस में बैठते हैं, we have all energy, we have the energy fields. अभी तो हम in person बैठे हैं, लेकिन जब हम डिस्टेंस रिलेशनशिप पे होते हैं तो अगेन वो एनर्जी फील्ड्स जो है वो मैटर करती हैं, लेकिन वो डिपेंड करती है कि हमने वहां पे कौन से वर्ड्स यूज किए हैं, हमने उस पर्सन से कैसे बात की है. इनफैक्ट अगर हम एक एप्लीकेशन का भी एग्जांपल लेते हैं, फॉर एग्जांपल एक मोबाइल ऐप है, देयर आर थाउजेंड्स ऑफ मोबाइल ऐप्स, लेकिन क्यों कुछ ऐप्स जो है वो ज्यादा यूज हो रही हैं और कुछ नहीं यूज हो रही. तो इट ऑल डिपेंड्स कि उस ऐप में आपने कितना जो है वो कंपैशन शो किया है, आपने पर्सन को कितना अट्रैक्ट किया है, उसको कितना अटेंशन दिया है, कितना ऑथेंटिसिटी से आपने वो ऐप बनाई है. जैसे फॉर इंस्टेंस अगर मैं जो है ये डिजिटल वॉच यूज करती हूँ, when I walk it just gives me sometimes एक सिंबल आ जाता है क्लैप का, या एक सिंबल आ जाता है ओके ग्रेट यू आर नाउ स्टैंडिंग, क्योंकि मेरा बहुत ज्यादा सिटिंग का काम है, और तो वो मुझे मोटिवेट करता है. तो वो छोटी छोटी चीजें जो ऐप के अंदर होती हैं वो आपको मोटिवेट करती हैं, वो आपको प्रेजेंस का एहसास दिलाती हैं. तो जो भी जैसे हम एप्स डेवलप करते हैं या पेशेंट्स को जो भी एप्स यूज करने का कहते हैं, तो उन सारी चीजों में ये सारी चीजें हमें जो है वो इंक्लूड करनी जरूरी होती है. Then these are some of the Caritas principles which Dr. Watson has given, that we have to be authentic what we are saying, we have to be kind. Even if we are saying something on a digital medium, we have to be sensitive to self and others by nurturing individual beliefs and practices, develop healing, trusting, caring relationship, and promote and accept positive and negative feelings as you authentically listen to another's story. क्रिएटिव प्रॉब्लम सॉल्विंग हम किस तरह से यूज करते हैं, अपने टीचिंग लर्निंग प्रिंसिपल्स को कैसे यूज करते हैं. It could be through emails, it could be through app, it could be through gaming, it could be through internet, it could be through online. जब हम ऑनलाइन टीचिंग करते हैं तो हम कितना जो है स्टूडेंट्स को ये इन्वॉल्व करते हैं, उसमें एंगेज कैसे करते हैं. तो इट ऑल डिपेंड्स कि आपने वहाँ पे जो है वो किस तरह से करिकुलम सेट किया है आपने. अगर वो सिंक्रोनस है, अगर वो एसिंक्रोनस ऑनलाइन कोर्स है, so what are the things you would do to engage these students? What are the things you would do to engage the patient? So those things are very important, and those competencies we need to learn as we move along towards the digital medium. So ये सारी चीजें बहुत जरूरी हो जाएंगी. These are some of the principles when we are doing the telehealth interaction, and that was again in research-based thing. कि जब हम telehealth conversation करते हैं, तो उसमें कौन से principles जो है हमें याद रखना है. For instance, it says that rather than standing, you sit during the interview. यहाँ पर जो है एक और चीज होती है कि when you are using telehealth, when you are doing, for example, when we were doing home visits in person, उसमें क्या होता है, you can observe the person and you can observe the environment. आप उसके एक्सप्रेशन देख सकते हो, आप उसका एनवायरनमेंट देख सकते हो, आप उसका घर देख सकते हो. लेकिन जब आप टेली हेल्थ करते हो तो आप सिर्फ उस पर्सन को देख रहे हो, आप उसके जो है उसके हैंड मूवमेंट्स प्रोबेबली अगर स्क्रीन जो उस तरह से सेट नहीं, आप नहीं देख सकते. आप उसके बहुत अच्छे से एक्सप्रेशन रीड नहीं कर सकते हो, आप उसका कॉन्टेक्स्ट नहीं देख सकते हो, आप उसका घर का एनवायरनमेंट नहीं देख सकते. तो दोज आर द चैलेंजेस वी नीड टू वर्क. उसके कोई सॉल्यूशंस अभी नहीं है हमारे पास, और मेरे पास भी नहीं है, और रिसर्च में भी इतना ज्यादा, अभी लिटरेचर में भी इतना ज्यादा नहीं है. बट एज द टाइम विल गो And as we move towards more and more telehealthing and more virtual cheezein, then we need to develop those competencies कि वो किस तरह से हम करें. Then detecting patients non-verbal cues of emotion. कि आप online कैसे उसके non-verbal cues को आप identify कर सकते हैं, कैसे recognize कर सकते हैं, आप उसको कैसे compassion show कर सकते हैं, what kind of language should you use कि उसको ऐसा लगे कि no, you are showing the presence, you are being attentive to that person's feeling. आप क्या non-verbal communication use करेंगे, कौन से verbal आप statements use करेंगे कि आप उसको ये एहसास दिलाएं कि yes, you are caring for the person. So these are some of the questions. Maybe I don't have the answer now, and literature may not have the answer. But as we move into the cyber world, we need to develop those competencies in our nurses, in our future nurses, and that's a challenge. The last thing, I think last time when I did an online presentation, I talked about this slide, that the first important principle to become compassionate, to become a caring nurse, is about your own self-care. जब तक हम खुद पे kind नहीं हैं, जब तक हम खुद का ख्याल नहीं रखेंगे, हम patient का ख्याल नहीं रख सकते. So self-care is not selfish. We have to take care of our own self. We have to be mindful of our own mental and spiritual health. How we support each other, how we empower each other. As I said, if we are oppressed, सुबह में आके अगर हमको हेड नर्स ने डांट दिया, तो हम पूरा दिन जो है वो मरीजों पे, हम फैमिली पे भी यही चीजें गुजारे. And it's not about individual. Then the organizational things also come, that how the organization supports you and how the organization helps you taking out all your frustration. So definitely सारे factors होते हैं, सिर्फ personal factor नहीं होता है. There are organizational factors also. कि आप जब, I remember जब COVID के दिनों में जब हम patient की care कर रहे थे, तो हमें भी fear होता था, क्योंकि हमें दोबारा उस patient के बाद अपनी family के पास जाना है. और हमें ये डर होता था कि हम वो infection यहाँ से वहाँ नहीं ले जाए. तो उस time पे organization ने हमको कितना support किया. So that everything matters. हमने आपस में अपने आप को कितना सपोर्ट किया, कितना कोलेगियल सपोर्ट था हमारा. There should be resilience programs like mindfulness, deep breathing exercises, counseling sessions, mental health support services. Those kind of things should be available within the hospital system. Or without organizational support, without a collegial support, we cannot develop compassion in ourselves. So this is the last pearl of wisdom, that establishing and consciously maintaining a firm intent to care is key to the process of manifesting a unique and enduring caring identity. So these are some of the references, and thank you for listening. And I hope you enjoyed the session, and if there are any questions, I am happy to answer.
If there are questions, we have few minutes at the end, we can ask. Thank you so much, Dr. Nasreen. This was a very good and time-based talk. We all are entering in cyber world, and entering from the world of caring into cyber caring is an important topic. Nurses like use of technology because it's helping us. It is for a provision of safe care. It is helping us to improve patient outcome, as well as it's saving our time. But please do not forget that the time which you are saving from patient care, that time also yourself need that time for yourself. So self-care is not selfish. I always like this notion. So thank you so much. So question, if you have question, you can ask later at the end. Thank you. Ji.
So again, thanks, Dr. Nasreen. It was a very good topic, and in fact, empathy, caring attitude, and compassion are the best ornaments of a nurse. Patient not need only the medicine and injection, and they need your ears, your good words, and your time presence up with the patient. So our next speaker is Lubna Ghazal, Dean Dr. Mukhtar College of Nursing, Multan. She will tell us the role of oncology nurses in developing resilience among cancer patients. So, Dr. Lubna Ghazal.
Thank you, Yusuf Sahab, for calling me Dr. Lubna Ghazal. It's still in the journey to become doctor, inshallah. So I'm a PhD scholar, and first of all, I would like to. I don't find any space for this. Let me first fix it. I would first of all give a great round of applause for Dr. Parveen Ali and Ms. Nasreen, because they both have set the stage for my presentation actually. So what I'm going to actually do is going to summarize their concepts of innovation and compassion and caring into my presentation. And I hope that you have huge experience in oncology nursing. So I'm hoping that you will be able to relate your experience and your patient's interaction within my presentation. So I'll take any of your question at the end of my presentation. So as Parveen also started her presentation with some of the data regarding cancer patients. And we saw that in near future, we will be having millions and millions of cancer patients. So therefore, it is important that we as nurses be very innovative, caring, and compassionate to understand better our patients. So with that, let's talk about resilience program. And Nasreen has mentioned this, that this is a very important program for the oncology nursing. So in my presentation, I'm going to focus only on two things. So since we all are now into research, so we will understand the problem of mental health among cancer patients, and we will try to find out a solution for them. So we all are aware that cancer itself is a very complex phenomena of one's life. It doesn't affect an individual. It affects their children, their spouse, the whole family. So, we need to, if we recognize this, we as nurses need to take in account not only patient who is in our care, under care, but their families also. Right? So we can't intervene maybe directly on their families, but intervening with this particular patient will help their families also. So let's talk about some numbers. If you see 47% of the patients, and this is one of the initial studies by Derogatis and colleagues in 83, they have actually identified a strong association of mental health, particularly they call it clinical syndrome, psychological clinical syndrome. And by saying clinical syndrome, they mean anxiety, depression, fear among cancer patients at that time. And this is one of the eye-opener study that told us that there is some strong relationship. If a patient is mentally strong, they have they interact with the disease in a very different manner, and they're very better. So particularly if you see that depression and anxiety are significantly associated with cancer patients. And we have to see that if they are not coping it well, so there will be low quality of life. There will be poor treatment adherence, there will be poor physical function and poor cancer survival and high cancer specific mortality. So see, this is very devastating. And again, some numbers. So this particular study, the first one, shows us that up to 55% patients under breast cancer treatment got depressed. So this is a big number. You see, this 55% actually tells us the dual diagnosis. Like the one diagnosis is cancer, the other diagnosis is depression, anxiety, fear, and depression, anxiety we know that they also coexist. Different diseases, but coexist. Okay, and then if there was a study about head and neck cancer patients, and again, we have the same percentage that they are being affected with major depressive disorders. And some of the colleagues like Henry et al., they also told us that about 16% of these patients are with suicidal behaviors. So you see that they know that cancer is going to take them on a fastest path to their lives, but they are also trying to end their lives through suicidal behaviors. So what else we know? So what could be the possible solution? We know now what is the possible solution. And because of that, all the oncological nurses are now thinking about adding an early psychological intervention, which is very, very crucial. And why it is crucial? Because it improves their mental health and it improves their quality of life. So therefore, we need to include this psychological intervention. And what that psychological intervention would be. So that psychological intervention would be development of resilience. And what is resilience? So have you seen rubber band? कभी rubber band को देखा है? खींचा है उसको? Play किया है उसके साथ? So हम उसको stretch करते हैं और फिर जब छोड़ते हैं तो क्या होता है? It bounce back. Similarly, resilience is a phenomena of bouncing back. So, for example, जितने भी हमें पता है कैंसर के साथ टर्न्स एंड ट्विस्ट होते हैं हमारी लाइफ में, डिप्रेशन, एंजाइटी गो थ्रू करते हैं पेशेंट्स, तो वो क्या करते हैं? If a resilient patient is there, he will bounce back. He will try to go to that shape जहां से उसको प्रॉब्लम शुरू हुआ था, right? So, what is it? It is again a process of adapting well in the face of adversity. Adversity, hardship, complex phenomena, trauma, tragedy, difficult or challenging life experiences. So, adapting it as it is. And there is another similar term which is used with resilience, that is mental toughness. Right? So what is mental toughness? It is a personality trait which determines in large part how individual deals with stress, pressure, challenges, irrespective of circumstances. Means if a cancer patient is having, difficulty coping with his life, that means whatever the circumstances are, we need to help them out to, go back, heal and go back to the normal stages from where he started or she started, right? So this is the intervention I'm going to talk about in detail. But why we have to do it, right? Intervention kyun karna zaruri hai? Because again, researchers told us that resilience program in the oncology patient is actually linked to 64% of reduction in the risk of emotional distress. And again, emotional distress means depression, anxiety, fear, etc. And it actually acts as a buffer between, all those emotional intensity which is running with an oncology patient. ये इसके लिए एक बफर बन जाता है, ये इसके लिए एक बहुत सारी रिसर्चेस इसको बताती हैं कि इट बिकम्स दी प्रोटेक्टिव फैक्टर. तो हमने अभी पढ़ा था 16% जो है हेड एंड नेक पेशेंट्स जो है वो सुसाइडल बिहेवियर्स के साथ थे. तो सुसाइडल बिहेवियर के लिए अगर हम ये रेजिलियंस प्रोग्राम शुरू से अर्ली इंटरवेंशन शुरू करते हैं तो देन इट विल बिकम अ प्रोटेक्टिव फैक्टर फॉर आवर पेशेंट्स. Again, one of the study by Lee et al. Involving cancer patient, and this was huge systematic review, and they have identified that agar resilience program introduce kiya jaye, so it lowers on negative effects such as anxiety, depression scores, and it raises emotional intelligence among cancer patients. And we know कि emotional intelligence का कितना बड़ा role है हमारी खुद की personal lives में भी. ठीक है, because emotional intelligence हमें help करती है how to deal stressful situation in our day-to-day life. So can we inculcate this? Can we build this? Yes. So the good news is, yes, we can help our patient to develop these skills. तो ये inborn भी होती हैं, लोगों के personality traits में भी होती हैं, but we can easily, अगर हम उनको help out करें, these can be built easily. So what it involves actually? So it involves mental, emotional, behavioral flexibility. So we teach our patients these skills, and these skills then help them adjust to external and internal adversity. It also involves, और आप सबने नाम सुना होगा CBT का, cognitive behavioral therapy, one of the strong evidence-based intervention that help us कि हम किसी भी stressful situation को कैसे address करें अपनी daily life में. So CBT basically is behind all this resilience program. So first of all, and again, I would refer to Dr. Nasreen's presentation, and she mentioned that grief. So when cancer starts, the grieving process starts. And I hope you all will be able to relate more than me, because you are directly, taking care of these patients with grief. So grief is, what? It's maybe a natural response to adversity, right? But there are three phenomena which are simultaneously happening. And what are these phenomena? The feeling may be, they may be in shock because they heard that this is, their disease is cancer, or cancer ka naam sunte hi, there is a lot of fear. Sabse bada fear is कि हम मरने वाले हैं, right? So, and when it comes to physical, जब आपके emotions इतने high intense run होंगे, then you will be having lack of sleep, right? Loss of appetite, nausea, pain, and you will be able to relate कि कुछ patients ये ज़्यादा feel करेंगे, कुछ patients आप देखेंगे उसको ज़्यादा accept करेंगे. So it depends on the personality traits that they have. And then behavior, like they may have some, negative behavior that they may show, and those negative behaviors would be substance use, less attention to self-care, दुनिया छोड़ के बैठ जाएंगे, isolate हो जाएंगे, अपनी treatment में involve नहीं होना चाहेंगे. So all those, negative behaviors. And you've been very well aware of stages of grief, right? You must have seen these patients into these stages. And these stages are, initially, they are in denial. Then they start with anger. Then they start with bargaining. Then they go into depression. And then they reach to a last stage, which is acceptance. So our role is to help them, facilitate them to the stage of acceptance. And acceptance doesn't mean कि वो ये accept करें कि भाई cancer हो गया है तो सब कुछ छोड़ के बैठ जाओ, ठीक है? नहीं, acceptance means कि जो हो रहा है उसको accept करें, whether आपको अच्छा लगे या ना लगे, because it exists, it won't go away, but you'll be able to help them to be prepared to, experience this pain which will exist with them. All right. So this is what acceptance is. So first of all, nursing assessment. So these are the assessment, including grieving stages. You need to ask these important three questions. And what are these questions? What have you overcome previously like this? ठीक है, पहले कभी आपके साथ इस तरह की कोई एडवर्सिटी हुई है, कोई हार्डशिप हुई है, और अगर हुई है तो आपने उसको पहले कैसे ओवरकम किया, खत्म किया, ठीक है? और जब आपने उसको ओवरकम किया, what has helped you in the past, right? And then the third important question is, how do you cope with adversity? So with these three questions, actually, you will be able to understand their previous experiences related to their stress, their life complexity, and then how they have utilized their psychological resources, their emotional resources, their support system to overcome this problem, so that you can utilize this information and help them with their current situation, right? And then some of their coping strategies. Unki coping strategies kya hai? Har kisi ki coping strategies, as I said, कि ये inbuilt होती हैं. I'm not sure if this video is available. No, it's not. So it's okay. So I brought a very short video for you, and uska मैं आपको summarize कर देती हूँ. It was about Isra, and I met her while I was, helping some of the teenagers, and I came to know that she is with Hodgkin lymphomas when she was 19. So I have a lot of experience working with adolescent population when it comes to depression and anxiety. So she just met me, and she was called by one of the organization in Karachi, namely Karwane Hayat, and Karwane Hayat actually works for mental health. So हम इसको shortly play करेंगे. Before I go to the pillars of resilience, I want you to have a look and identify some of the natural, personality traits in this girl that will help you understand कि naturally लोगों के अंदर resilience कैसे inbuilt होता है और हम अपने patients में इसको कैसे promote कर सकते हैं. Do we have sound, please?
तो मुझे जो डायग्नोज होने में 6 महीने लग गए थे, उसका सबसे बड़ा रीजन ये था कि मुझे कफ डेवलप हुई थी. उसके बाद मेरे सिम्टम्स जब बढ़ते गए तो डॉक्टर्स ने इसको टीबी इसलिए डायग्नोज किया क्योंकि मेरे लंग्स में बहुत बड़ी एक कैविटी प्रेजेंट थी. जब उन्होंने एक्सरे करके देखा, ऑब्वियसली मुझे टीबी नहीं था, तो उससे मेरी कंडीशन और बुरी हो गई. मेरा वेट कुछ 35 kgs हो गया था. तो फिर जब मेरी फाइनली डायग्नोसिस हुई, मैंने अपनी रिपोर्ट में हॉजकिंस लिम्फोमा पढ़ा. तो जब मैं पढ़ रही थी तो मुझे हॉजकिंस स्पेल करना नहीं आ रहा था और फिर मैंने देखा आगे लिम्फोमा इसके साथ लिखा हुआ था. लाइक ओमा मीन्स ट्यूमर, तो मुझे कैंसर है, विच वॉज अ रिलीफ फॉर मी, क्योंकि मैंने इतना लंबा स्ट्रगल किया था फ्रॉम द अननोन कि मुझे सिर्फ ये था कि एटलीस्ट आई डिजर्व टू नो कि मेरे साथ क्या मसला है. ये हिम्मत नहीं हारती थी. डॉक्टर्स के साथ पूरा डिटेल में जाके अपनी हर चीज को डिस्कस करती थी, वो करती थी. सबसे ज्यादा यही बस मुझे यही था कि मैं समझाती इसको रहती थी, और सबसे ज्यादा यही कि तुम मजबूत रहो. अल्लाह ताला जो है इंसान को उसकी ताकत से ज्यादा बोझ नहीं डालता.
हॉजकिंस लिम्फोमा जो है वो एक गदूद का कैंसर है जो कि जिस्म के अंदर
आईने में देख नहीं पा रही थी और मैंने काफी दिनों तक अपने आप को नहीं, इतना ज्यादा उस फेज में डिप्रेस हो गई थी कि मैं अपनी शक्ल आईने में देख नहीं पा रही थी और मैंने काफी दिनों तक अपने आप को नहीं देखा था शक्ल, क्योंकि मुझे देख के रोना आ रहा था अपने आप को. मैंने अपनी दोस्त को कॉल की, उससे कहा मेरा घर आके शेव कर दो हेड. उसने मेरे सारे बाल उतार दिए. उसके बाद उस दिन मैंने अपने आप को मिरर में देख के ये बोला, देखो इसरा राइट नाउ यू आर ट्राइंग ओवर इट बट आई बिलीव इन यू कि तुम इस चीज से निकल आओ.
जो इसरा के जैसे पेशेंट्स हैं वो कम तादाद में होते हैं और उनके अंदर जो है वो बीमारी कीमोथेरेपी को सही से रिस्पॉन्ड नहीं कर रही होती है. हमें ये देखना बहुत जरूरी होता है कि जब हम कीमो लगाएं तो जो भी बीमारी है या जो गदूद है वो नॉर्मल होना शुरू हो जाते हैं, बीमारी खत्म होना शुरू हो जाती है. लेकिन कुछ बच्चों के अंदर ये देखा गया है कि बीमारी अगर रिस्पॉन्ड ना करे तो गदूद बढ़ना शुरू हो जाते हैं, जिसका मतलब ये है कि बीमारी कंट्रोल में नहीं आ रही. तो हमें कोई ऑल्टरनेटिव ट्रीटमेंट की तरफ जाना पड़ता है, सेकेंड लाइन कीमो की तरफ जाना पड़ सकता है. और कुछ
little case study which I'm going to utilize when we will talk about these 5 pillars. सो अगर आपने इसरा को देखा हो तो उस आपने छोटा सा एक क्लिप मिस किया इसरा का, जिसमें उसने फर्स्ट अपनी ओपनिंग स्टेटमेंट में कहा कि जब मुझे पता चला कि मुझे कैंसर है तो सबसे पहले जो मेरे मुंह से अल्फाज निकले वो निकले अल्हम्दुलिल्लाह. So Isra used Alhamdulillah because of knowing कि अच्छा मुझे पता तो चला कि मुझे है क्या, अब मुझे पता चल गया है कि है क्या, तो मैं अब उसको ओवरकम करने की कोशिश करूंगी. So this trait is a trait जब हमें ऐसा लगा कि ये acceptance है, but later she tells you about कि मैं डिप्रेशन में गई, सबसे इम्पोर्टेंट मेरे बाल थे, जब वो निकलना शुरू हुए तो मैं बहुत जब मैंने अपने आप को शीशे में देखा तो मैं रो रही थी. देन कम्स शी कॉल्स अ फ्रेंड कि तुम आओ मेरा हेड शेप करो, ठीक है. एंड देन उसकी फ्रेंड ने उसको सपोर्ट दिया, साइकोलॉजिकल सपोर्ट दिया और कहा कि तुम इससे ओवरकम कर जाओगी. And I hope you've noticed the mother and the child relationship, and you could see how the smiley face of Isra, that she was actually supporting her mother. If a patient is like that, the family is then, in rest, relaxed. Okay, mera bacha is able to, look in the face of this adversity and hardship and managing well. Isra is mashallah now taking her education well. She is one of the leader on a support group for such children, and we utilize her to help and support others. So let's talk about now pillars, and let's connect with Isra and other patients which I have came to know through literature search. So सबसे पहले is self awareness. So हम सबने नर्सिंग की है, आप सबने जोहारी विंडोज पढ़ा होगा, याद है जोहारी विंडोज? Okay, so we are talking about actually that self awareness, जिसमें we get to know what are our strengths and what are our limitations, right? And now positive psychology actually emphasize more on its strengths. Okay, let's leave the limitation, let's more work on the strength. जैसे इशरा की मदर ने उसके बारे में कहा, ये बहुत हिम्मत वाली है, right? She is a positive spirit with a lot of courage to face her cancer. So self-awareness is very important when you have to face such a complex phenomena like cancer, right? And then mindfulness. Dr. Nasreen talked about mindfulness. So what is mindfulness? Mindfulness is, cancer is a very, very complex disease. It has a very, very complex treatment sessions. So 25 session, 24 sessions still kam nahi hota hai, right? So how this patient are going to experience these sessions? So सुबह उठ के अगर उनको ऐसा हो कि अभी मुझे कीमोथेरेपी के लिए जाना है, मुझे नौजिया होगा, मुझे वॉमिटिंग होगी, मुझे पेन होगा, मुझे किसी को अपने साथ ले जाना है, वो मुझे छोड़ेगा, डिपेंडेंसी, all these guilt feelings, sadness, and then anxiety. All right, my time is up. So you see, so mindfulness, मैंने एक cancer program देखा for breast cancer patients, whereby one of the lady talked about कि मैं अब ऐसा करती थी कि मैं ऐसे नहीं सोचती थी कि मैं कैंसर की कीमोथेरेपी के लिए जा रही हूँ, मैं सोचती थी आज मेरा येलो वीक है, तो जब मैं अपने सेशंस के लिए जाऊंगी तो मैं कुछ ना कुछ येलो कलर में जाऊंगी. So और मैं फिर उसको कट करती थी कि एक येलो हो गया मेरा. So, changing the perspective, living in the present, changing our thoughts are very, very important and makes a person mentally tough. And then self-care, as Dr. Nasreen also talked about, self-care is very important. अपनी सेल्फ केयर करें, अपनी उनको सिखाएं कि कैसे वो जो है जब कीमो के लिए भी आए तो कितना अपने आप को कैरी करें, ठीक है, अपने साथ आने वालों को जो इसी तरह तैयार करके लाएं. सो उनको हमें इंगेज करना है कि यस इट्स अ प्रोसेस, इट विल हैपन, ठीक है. सो व्हाई डोंट वी मेक इट हैपन विद हैप्पीनेस, विद मोर करेज, ठीक है, एंड एक्सेप्ट कि हाँ पेन हो रहा है तो हो रहा है तो होगा, ऐसा तो होगा, ठीक है. And then positive relationship support is very, very important. When a person is going through all these treatment, support system is required, friends are required, family support is required. There are mothers जिनके छोटे बच्चे हैं, हो सकता है वो उनको स्कूल छोड़ने जाती हों, ड्यू टू कैंसर ट्रीटमेंट अब वो नहीं जा पाएंगी, हो सकता है कोई नेबरहुड में ऐसा बंदा हो, कोई रिलेटिव हो ऐसा जो उनको इस तरह की कोई सपोर्ट दे सके. So, investigate about their support system, their relationship, and help them. And then purpose. Now, Isra ki life ka purpose is to help other teenagers with such problems. Okay, so help patients identify what purpose is. और जैसे हमारी एक colleague ने भी बताया था कि एक cancer patient को beats देती हैं ताकि वो दूसरे cancer patients इस्तेमाल कर सकें. Maybe this has become the purpose of her life, right? So these are the pillars of resilience care. And basically एक resilient person लगता कैसे है? Resilient person will focus on events that they can control. और जिनको वो control नहीं कर सकते, they let go. ठीक है? Not seeing themselves as a victim, right? Viewing setbacks as, these are impermanent. ठीक है? ये खत्म हो जाएंगे. And these are some of the characteristics जो कि एक resilient person के अंदर हमें नजर आती हैं. And now I would like to conclude, and this is again a cancer survivor patient जिसने resilience program के बारे में अपने कुछ ख्यालात का इजहार किया है कि resilience is accepting a new reality. Yeah, silver lining. Even if it is less good than the one you had before, you can fight it. You can do nothing but scream about what you have lost, or you can accept that and try to put together something that's good. So innovate, right? Innovate what has been broken, right? So as nurses, this is our responsibility कि हम उनको अब assess करना शुरू करें, हम promote करना शुरू करें early psychological intervention like resilience program into their care. Thank you so much.
Thank you, Lubna, for giving such a wonderful information. I think I always feel that being a Pakistani, we are the most resilient society. And whatever happens, we are there to, bounce back. Especially the faith that we have and the family support are the important pillars towards resilience. जब मैं spirituality और faith पे काम कर रही थी during my PhD, so my two boys, we were sitting in a restaurant and my older one asked me, Mama, what you are studying about spirituality? What is spirituality? What does it do? Like if a person is hungry and there is nothing on the table, what spirituality can bring for that person? And I was like kind of quiet at that moment and I didn't had any answer because he just, put me on the spot and he asked that question. And I really thought, okay, what does faith do if a person is hungry and doesn't have anything on the table to eat and he's hungry? So my younger son, the older one was at that time, I think he was 16 and the younger one was, there's 5 years of difference, so he was 11. So he said, it'll bring hope. So yes, hope is there and faith brings the hope for that person who is hungry, who doesn't have anything. So there are a lot of things which brings resiliency to the table. Your faith, your family support, your collegial support, your organizational support, everything matters. So thank you very much. All the sessions were wonderful. And I think we are moving to the research.
Yeah, we have last session, which is a free paper, will be presented by one of our Assistant Director Nursing Education, Frida Khan, working at Shaukat Khanum Memorial Cancer Hospital. This study titled as Nurses' Perception and Challenges in Identification and Provision of Psychological Care to Cancer Patients. Ms. Frida.
Bismillahirrahmanirrahim. Assalamu alaikum and very good morning. My name is Farida Khan, working as Assistant Director, Nursing Education at Shaukat Khanum. This research we have completed in July 2022, and I would like to share the results of our study. So the title of our study was Nurses' Perceptions and Challenges in Identification and Provision of Psychological Care to the Cancer Patients. As you already know, that nurses have cancer have a very have impacted on many. Like cancer has an impact on individuals that is more than just physical. There are emotional, psychosocial, spiritual, and financial as well. From the time a person thinks that there may be something wrong throughout diagnosis, treatment, and follow-ups, changes occur because of the disease and its treatment, which can have an impact, in fact, in a profound impact on the individuals with the illness and their families. According to a study, according to a study which was conducted in 2022, addressing full range of needs patients and families experience requires psychosocial interventions in addition to those who are aimed at curing or controlling the disease. Evidence indicates that unmet psychological needs results in increased emotional distress, decreased quality of life, and reduced compliance with the treatment. Abu Oda and Leo 2020 also understands the importance of nurses' role in identification and the treatment of psychological issues. They have mentioned in their study that nurses have direct contact with the patients, and they are in the best position to provide psychological care. However, this is very important that the nurses should be competent and they should understand the psychological health very well. They should have the skill and relevant knowledge to give the psychological care to their patients. Hence, our study aimed to explore the oncology nurses' perceptions of psychological care and to identify what they perceive as barriers and challenges to its provision. So while doing the literature review, we researchers identified that we were unable to even identify a single research particularly in Pakistan, which were focusing about the oncology perspectives from the nurses' perspectives. Therefore, this kind of triggered us to do a research in this area. So through exploratory qualitative design, we recruited 20 nurses and we used a convenient sampling method to recruit those nurses. We included registered nurses who are working in the inpatient departments of the Shaukat Khanum Hospital and with the minimum 6 months experience at the Shaukat Khanum. Nurses who refused to participate in the study and those who were enrolled in the post-RN oncology program and the diploma program, as well as those have already completed the specialty or diploma in oncology, were excluded from the study. Before collecting the data, we sought the ethical approval from Scientific Review Committee and the Institutional Review Board of Shaukat Khanum. And we also took the informed consent from all the participants. In-depth face-to-face interviews were conducted individually with all the participants, and the interview were lasted from 40 to 45 minutes. And during interview, investigators took the notes, and demographic data was analyzed using the descriptive statistics, whereas for the qualitative portion, we used thematic analysis framework, which involved reading all the transcripts, analyzing them one after another. And the data was first grouped into codes using the common keywords from interview scripts, and then we formed sub-themes and themes later on. This table shows the demographic data of the nurses. Out of 20, there were 11 male nurses, whereas 9 were female, with a mean age of 29.75. 7 the participants have diploma in nursing, 12 have a degree in nursing, whereas 1 had a master's in public health degree. And the total experience, overall experience of these nurses ranged from 10 months to 20 years, whereas the Shaukat Khanum, they had an experience of 8 months to 11 years. As I talked about the qualitative portion, there were 5 themes, major themes which were emerged through the data which we go through the qualitative portion. And these 5 themes were patient's management of the emotions and situations, holistic care, factors which are impacting on the psychological health of the patients, common psychological problems and their identification, and then how the nurses were addressing those psychological problems, and also the challenges which they were facing while addressing those problems. So I would like to talk about these themes one by one. Cancer patients not only go through as we already discussed, they not only go through the physical symptoms of the discomfort, but they also face emotional and psychological and psychosocial distress. So the first theme, like majority of the nurses or the study participants, they verbalize that if they were asked the question like importance of the psychological health, and then how a person, what kind of a person who they believe that the person is psychologically fit. आप कौन से patient को कहोगे कि इसकी psychological health बहुत अच्छी है. So in response to those kind of questions, they responded that psychological, as one of the participants mentioned, that psychological health means you are relaxed, there is no pressure, and whatever the problems you encounter, you respond to them in a positive manner, and then you decide and you act on accordingly. Another participant mentioned that stability in sentiments and emotions in response to the certain situations, like whether you are happy or whether you have fear or grief, but you are tackling your problems according to the situation. So it's a kind of your psychological health basically deals with your coping strategies. The second theme was holistic care. Most participants agreed that providing holistic care was important for good nursing care, and that included more than only medical issues. So in this theme, there were 3 sub themes were merged, like physical health, physical health, mental health, and spiritual health. And these are very important, and the nurses need to fully understand these 3 components in order to provide the holistic care. There was another study, and their results were very familiar to our study, where they also identified the spiritual, physical, and mental health as part of the holistic care. The third theme which were merged was related to the factors which were impacting on the psychological health of the patient. So one of the participants mentioned, again, in this theme, there were again 3 themes merged. Number 1 was nurses' communication skills. Number 2 was family support or the social support. And then number 3 was hospital environment. As one of the participants mentioned that, I think in order to know the needs of the patient, you need to communicate with them. And then you will know what they need. And our study findings were also supported by one of the studies which were done by Belchers et al. In 2016. And good communication between nurses and patients results in better medical care and greater rapport building. And thus, this is the basis of therapeutic relationship. So another participants mentioned that if the family is cooperative, then the patient will have less psychological problems. And that is pertinent to the second sub-theme, which I talked about, the family and social support. Our fourth theme was related to the psychological problems, how nurses were identifying the psychological problems, and then what kind of sign and symptoms or the most common sign and symptoms which were manifested by the patients. So nurses agreed that most of the time they would see a fluctuation in the vital signs such as increased heart rate and pulse, heart rate and blood pressures and pulse rates, and all as well as in the form of mood changes or the mood swings, like the person would be for a while very happy and then just start crying. They would isolate themselves from the care, and then they will not listen to you, and then they will communicate like hopelessness and helplessness. And nurses were able to rule out these common psychological manifestations through the initial assessment, during history taking, and as well as they were also identified in the verbal and non-verbal clues. So the last theme was how the nurses were addressing those psychological problems. Most of the, in fact, majority of the nurses revealed that they counsel the patient first, and then they let the patient speak about their fears and their problems. But if the problem is not resolved, then they refer the patient to the primary team, and then also they refer to the psychologist. As one of the participants mentioned, in the nursing assessment, we use screening questions. If I identify any problem and patient need help, then an alert is automatically sent to the psychologist. And this is, I'm talking about the Shaukat Khanum, because we have a strong system where the alerts go to the psychologist. So the challenges which are faced by the nurses, workload and lack of experience, particularly in psychological management, were identified as the challenges. This study, in conclusion, I would like to say that in our study, the participant appreciated the importance of the psychological health, and they also appreciated that if we understand the psychological health, then we will be able to identify and then we would be able to provide holistic care. So I believe that this study is the first of its kind to be conducted in Pakistan, to explore the oncology nurses' perceptions and challenges regarding psychological care in cancer patients. And further studies can be conducted to explore the perceptions of patients towards psychological care, as well as the various strategies that nurses may use, as we already talked about the workload issues that can be tackled so that the psychological care can be provided to the patients. I would like to acknowledge my co-investigators, Ms. Rehana Ilahi and Ms. Noshin Qureshi. I would like to convey my special gratitude to Ms. Musarrat Paveen, Mr. William Chaman, Ms. Saima Rubak for facilitating us in arranging the interviews. Last but not the least, our study participants who were very wonderful, and they were able to give us at least 40 to 50 minutes, and the discussions were very eye-opening. Thank you very much. These are the references. If you have any question, I can take the questions.
Thank you, Frida, for your wonderful experience of this study, first of its kind in Pakistan. This was our last session, and we have 10 minutes for question and answer sessions. And we have all 4 speakers present in the hall. You can raise your hand, come to the mic, and ask your question. Yes, please.
Thank you, Ms. Farida, for a very nice presentation and for sharing the results of your research. I just have 2 queries. One is about the, for interviewing the participants, did you use the open-ended questions, or did you have an interview guide or something like that? And the second question is that when you mentioned the inclusion and the exclusion criteria, so in that you mentioned about the BS and the diploma students. So was there any specific reason or justification to exclude them?
Thank you very much. I would like to answer the second question first. So the reason of excluding the students who are enrolled or who have already done the post-RN oncology nursing was that because these students have already gone through detailed training on the psychology, on dealing the psychological aspects and identifying. So we thought that including these participants may introduce a bias, knowledge bias in our study. So that was the reason we excluded this population. And your first question is, yes, we developed a semi-structured study questions, and it has almost 12 to 13 questions, and they were open-ended questions. But we were not restricted to that particular questions. But if we identified any other part during the discussions, we also added that as a part of the question. So there were semi-structured questions open-ended.
Yes, there's another question.
Ji,
Yeah,
Lubna.
Lubna, please. Yep.
So Farida, this was a qualitative study design, right? So what about, I want to know your reflection on the themes. Do you think these themes are overlapping with each other?
Initially, there were 7 themes, and then we identified the major. We identified the major themes, but initially there were 7 themes. There were some points while even when we were looking at the investigators again analyzing the responses and themes one by one, we also have thought about that there are certain things which can be, say, for example, patient management and the response to the situation can be merged with the theme where we were talking about the sign and symptoms and the management. So these themes we also thought of merging together. In a qualitative studies, there are the certain themes which sometimes you feel like they can be overlapped and they are they can be merged.
There's one more question, and that should be the last question. And we have few points to share with you, and then because the time is getting short.
Hello. My question already asked by Ms. Salima, and you answered them. You did excluding criteria of a BS oncology and diploma students. You respond that they can bias, but you in inclusion criteria, most of the participants have a 8 to 10 year experience. They are well experienced. Maybe they can be biased in these studies. Yeah, 8 months to 10 years. I think. Thank you.
If I look at the responses we also explored tried to find out whether the nurses who have experience of more than 10 years or even more experience, were they able to respond differently? But during the analysis, it was identified that we would not see any difference between a nurse who have just joined or a nurse with, who have more experience. But you are very right when we talk about the handling of the psychological problems. The experienced nurses, when they were asked how they handle, their answers were a kind of more sophisticated and articulated as compared to the responses which were given by the novice nurses. So in journal, we could not see any kind of difference in this case. Yeah.
Okay, so since nurses are very enthusiastic in higher education, and we have a session tomorrow also, Dr. Nasreen have kindly brought news for you, and I would request her to share.
I wanted to share the new PhD program that we have started at Purdue University. So I have some flyers with me also. So
Sure.
there are details about it. Thank you. I just wanted to share about the PhD program that we started at our university. So I have brought some flyers. You can see the details in the flyer, but anybody could apply if they have done their masters. And we have two programs. We have BSc and two PhD program also. So now we have started that people who have done BSc and they can go directly, they can do the PhD, and we have another program where you are master's qualified and then you can go over PhD. So there are both these programs available. The minimum GPA for the admission is 3, and there is some guidelines about the English proficiency, and then it's a fully funded program. So if you apply at Purdue University, they definitely help you support your funding also, and they give you the teaching assistantship and they give you the research assistantship so you can support your tuition fees and other things. But we definitely encourage other funding opportunities. So everybody is welcome to apply for the PhD program, and it's not only in nursing. We have another program which is affiliated with nursing, that is Center of Aging and Life course. So there's dual PhD career program also. So it's not that if you want to do something in aging, so you can have a supervisor from the nursing specialty, and then you can have a supervisor from the aging faculty, and then you can do a dual career PhD also, where you can learn about aging and other processes that affects the aging. So you can do a dual career PhD also, and then we have other nurse practitioner faculties also, which are in family nurse practitioner, pediatric nurse practitioners. So if you want to pursue something in public health, or if you want to pursue something around family health, so there are different kind of PhD specialties available and faculty specialties available. So I will just keep those flyers with Rihanna. So if you are interested, you can always ask Rihanna, and ask if you have any questions, you can connect with me and I can further explain the things to you.
So with this note, we close our first session of nursing, oncology nursing of today. I hope you all have enjoyed, and there was a lot of learning in this session. And I request that everybody join tomorrow again with the same zeal and zest. The symposium is going on. There are a lot of other oncology sessions happening in the halls. Screens are available. You can go and see where you are interested, and you may have downloaded the program. So you can go and join the other sessions. Thank you so very much.